What I talked about was the use of what's called the bioplate and in patients with Chiari and related disorders. Do you do this just on everybody who has any sort of sagging of their cerebellum? Well, no. Like most things, you have to select your patients. Essentially, the bioplate is something that we use in certain cases. It's not for every case, but we particularly use it when after patients had a previous surgery, and particularly if the bottom part of their brain, the cerebellum, has slumped down, what we call ptosis. Here is the more classic cerebellar ptosis with this arrow showing the edge of the bony decompression, and you can really see how this cerebellum, not just the tonsils, but really the cerebellum itself is really dropping out of the skull. These patients can oftentimes have debilitating headaches, which affects their quality of life and occupation and the like. And so what we did today was we basically gave a little background information about this disorder and about how we use this plate to actually support the cerebellum and provide some sort of support so that the brain isn't sagging anymore, and our results that it really helps a significant number of patients with this problem. Actually, it works out really well, and what you can do with this type of sponge, or really any type of sponge, is to put this in the defect, in the back of the head, and use that with an ACE wrap to actually support the cerebellum. It's kind of controversial about what to do for these patients, and this is something that's relatively straightforward, relatively simple to do from a surgery standpoint. The patients tolerate it very well, and it seems to help.